Mark.
Yep.
Spring's here.
Spring is here.
Asheville's had its first spring.
Yep.
The daffodils are blooming.
Yep.
The Bradford pears are blooming.
Yep. Which means we get snow next week.
Yeah, but it also means that this week
Yeah.
we have ticks.
We do.
I'm
We have
seeing
ticks.
them. They're
Yep.
coming in.
Yep.
And we have Lyme. So
We do. We are starting to see some Lyme infections.
Yep. What I always say is when the Bradford pears bloom, that's when the ticks are out. Now, that's changed a little bit
I think
recently.
so. Yeah. I can think of over Christmas time pulling several ticks off of both dogs and cats. So I can think of seeing a number of patients that we saw them even in the winter.
Right. So I may have to reevaluate
Yeah.
my Bradford pear.
Yeah.
But they are blooming. We
Yes.
are seeing them.
Right.
Basically, if the Bradford pears are blooming, it's warm.
Yeah.
If it's warm,
Yeah.
there's ticks.
Yeah. And of course, there's lots of different, besides Lyme disease, there's a lot of other diseases that ticks can transmit. So we want to do everything we can to prevent that. And a lot of these ticks are tiny, so they're hard to find on your dog or cat sometimes.
And a lot of them are carried by deer.
Yeah.
And this area of town
Yeah.
has deer.
Yep, we sure
So,
do.
NexGard and Brevecto.
I like both of those.
And so then NexGard is a once a month.
Mm-hmm.
Brevecto is once every 3 months.
3 months, and they work well for pretty much most of the common tick species that cause infections in our area, like the deer tick and the Lone Star tick and the whatever other ticks we have around here that I'm drawing a blank on.
The new tick that just came to
right.
town that
Yeah.
is a terrible tick that,
Yeah.
So
That's livestock.
things that kill ticks.
Yes. Yeah.
So
The thing I always remember to tell people though is that ticks are hard to kill. So if you can still find a tick, a live tick, you can even find a tick that's bitten your dog or cat, and doesn't mean that the medicine's not working. It just ticks are hard to kill, and it can take sometimes 10, 12 hours to get rid of those ticks.
And the important thing is the tick has to be dead within 24
Yeah.
hours
Yeah.
to not transmit
Right.
a lot of these diseases.
Right.
And NexGard and Brevecto kill them before 24 hours. Some of the other medications, they kill them eventually, but
Right.
not in that amount of time.
Yes.
So
Correct. So you're always going to be pulling a sick, dying tick if we're using the proper medications. I guess our only issue nowadays, though, is that with those types of Brevecto, NexGard, the exosazoles, is the seizure thing. The FDA recently came out with a warning. Not that you can't use that in dogs that have had a seizure, but you have to be more cautious. But I don't think it causes seizures in dogs. I think if they're predisposed to having seizures, it might make it a little bit more worse for them. But certainly we need to know that information when we're prescribing it.
or if your dog has any type of neurological activities after you give it,
Yeah.
then we should
Yeah.
see the dog and
obviously
reevaluate.
Sure. 'Cause
whether
there
this
are
is a
other
proper
options.
medication.
Obviously, there's other options like the Seresto collar and frontline, things like that can also work for ticks. I don't think they're as great for fleas, though. And that's the nice thing, I think, with the NexGard and the Brevecto is they work really, really well for fleas. And that can be just as big a problem as ticks can.
Right. A whole different thing that starts slow and builds up through
Yeah.
the year.
Yeah.
So we're right now experiencing a kind of lull
Mm-hmm.
in the flea world, but the ticks are coming up.
Yep.
So
Yeah.
um,
And we're, of course, we don't have our little map behind us, but, we've got our map in our office that we're kind of trying to keep track of that. And we're coming up with, a few cases here and there of dogs coming up positive for either Lyme disease or anaplasmosis or ehrlichiosis. That's a nice thing with our heartworm test because then we're, besides checking for just heartworm disease, which of course is a mosquito-transmitted disease, we're also checking for some of the more common tick-borne diseases. So that's a nice feature of the screening tool of doing the blood work every year on dogs.
yeah, I'm not sure that our clients really know that when
Yeah.
they get that heartworm test done,
Yeah.
we don't talk about it, but we're actually looking at some of these other
Yes.
really kind of nasty diseases that
Yeah.
are out there.
And as they sure, you probably notice too, the ones that come up positive, they usually aren't sick. I mean, usually the dog is feeling pretty darn normal. So that's can make it a little tricky too. So what do you do about it if the dog's not sick or not? But particularly with Lyme disease, I think the last meeting we were at, they were still recommending treating for it, even if you weren't seeing clinical symptoms, just to hopefully prevent kidney problems down the road. Because that's one thing I think the IDEX lab who we use, I think they just published a study where the dogs that were Lyme's positive actually had a higher incidence of kidney disease later on in life. So by treating it, even though we may not be able to eliminate every single one, hopefully we're going to be able to keep those kidneys working more efficiently as they get older.
Treat it if they're positive.
Yeah.
Prevent it.
Yep. That's the best way
If
to.
you can.
And for those dogs that maybe are in a real high area of ticks, we do also have Lyme's vaccinations, which I think is not an unreasonable thing to consider for those dogs that we think are going to be at risk.
Right.
Yeah.